Have you ever scheduled something, anything, just to get it done before the weekend? A doctor's appointment, a home repair, a haircut. We all do it. But what if I told you that when it comes to surgery, rushing into the end of the week could quietly increase your risk of serious complications? Or worse? I'm not trying to scare you. I'm here to gently open your eyes to something most people never think about until it's too late. It's not the surgery itself that's always the problem. It's when you have it. This is something I wish I had known much earlier. And once I learned it, I couldn't believe how little it's talked about. So today, I'm going to walk with you through something every senior, and really anyone planning surgery, should understand. Because timing, as it turns out, might just save your life. I remember a neighbor of mine, Alice. She was full of life, the kind of person who brought cookies to every neighborhood meeting. One day she told me she was going in for a minor procedure. Nothing urgent, she said, but she scheduled it for a Friday so she wouldn't miss her weekend plans. The surgery itself went well, but by Sunday, Alice wasn't feeling right. Her incision looked red, and she had a slight fever. Her daughter tried to call the doctor, no answer. They went to urgent care, limited staff, long wait. By the time she was seen, her infection had progressed. She ended up in the hospital for 10 days. 10 days, all because help was slower to arrive. She recovered. But not everyone is that lucky. What Alice experienced is part of something researchers call the weekend effect. And this isn't just a theory. A study of over 429,000 patients found that surgeries done just before the weekend, especially on Fridays, carry a 5% higher chance of serious complications or even death. Why? It's not that surgeons do a worse job on Fridays. The issue is what happens after the surgery. When you're recovering, watching for signs of infection, bleeding, blood clots, or other problems. Over the weekend, hospitals often have fewer doctors and nurses on call, reduced emergency response teams, delayed access to imaging or labs, less experienced overnight coverage. That means if something goes wrong, even slightly, the time it takes to notice and respond can be the difference between a small setback and a tragedy. As we age, our bodies don't recover quite like they used to. What might have been a small fever or slow healing at 40 can turn into something more serious at 70. The margin for error gets smaller, and when you're alone in recovery, or even just groggy and confused post-op, you may not notice subtle symptoms. That's why the care team around you matters so much, and that team is simply thinner on the weekends. This doesn't mean you shouldn't have surgery, but it does mean that when you schedule, it can quietly affect your outcome in ways no one may warn you about. And that's why we're here, to talk about what most people won't. Let me tell you something that truly opened my eyes. In one hospital system in Canada, researchers reviewed hundreds of thousands of surgeries performed between 2007 and 2019. They discovered that when patients had their operation on a Friday, their chances of dying within 30 days increased by 9% compared to surgeries done on a Monday. The risk rose to 12% at the 1-year mark. We're not talking about rare or risky surgeries either. These were common procedures: appendectomies, gallbladder removals, even hip and knee replacements. The researchers called it statistically significant and clinically meaningful. And for patients like you and me, that means something very real. Think about a typical hospital weekend. Senior staff, home. The best specialists, off duty. The full surgical team, gone until Monday. Diagnostics like MRIs or CT scans, limited hours, longer waits. Even when the hospital is open 24/7, the full support system simply isn't there. So if something goes wrong Saturday morning, your care might be handled by a reduced or unfamiliar team. People who weren't in the operating room, who don't know your case as well, and who are stretched thin. Now imagine, you just had surgery the day before. You're vulnerable, maybe still under the effects of anesthesia. Maybe your blood pressure drops or a fever kicks in, and no one notices right away. That's where those small delays become serious. Beyond the statistics, let's talk about the emotional side. For many older adults, hospitals are already stressful places. Add in post-surgery confusion, fear, or pain, and then place that experience over a weekend with fewer familiar faces. I've spoken to people who said they felt forgotten during weekend recovery. Not intentionally, of course, just caught in a system that was too quiet, too slow, too understaffed. One woman told me, "I rang the bell 3 times before someone came. I wasn't in danger, but I was scared." That kind of stress slows healing. It weakens the immune response. It makes pain feel sharper and time feel longer. And all of that matters, especially as we get older. Now you might wonder, why doesn't anyone warn you about this? Well, some doctors do. There are compassionate, thoughtful surgeons who'll quietly steer their patients toward earlier in the week slots. But many don't say anything, either due to scheduling pressure or lack of awareness. A retired surgeon once told me, "We always preferred Monday or Tuesday surgeries. That way, we could watch you closely during the critical first 48 hours. By the weekend, most patients were stable, but if we had no choice but to operate Friday, we crossed our fingers." That's not exactly comforting, is it? But it's honest, and that's what this video is about. Honesty. So what can you do? You can ask. Ask your doctor or surgeon, when would you schedule this for your parent? Will the same team be available to check on me post-op? What happens if I need help on the weekend? You can speak up. Request an early week surgery date. Avoid Fridays unless it's absolutely necessary. If you must go in later in the week, arrange for a loved one to be there post-surgery to advocate for you. You deserve full attentive care, not just when you're on the table, but for every hour afterward. Let's now focus on what you can do before the surgery even begins. The first and most powerful tool you have is knowledge. When your doctor recommends a procedure, ask these 5 simple questions. Is this surgery urgent, or can it be scheduled later? If it's not an emergency, you may have more control over the day and time. What day of the week will I be operated on? Don't be afraid to say, "I've read about better outcomes for early week surgeries." Can we aim for that? Who will be on call for me after the surgery? Will it be your surgeon, a hospitalist, a resident? Knowing the chain of care matters. Will I be monitored closely the first 48 hours? Ask how frequently you'll be checked and by whom, especially if staying over the weekend. How experienced is the team with my age group? Older adults may have different needs and complications. It's okay to want a team familiar with seniors. The first 48 hours after any major surgery are like standing on a tightrope. It's a delicate balance. Your body is healing, adjusting, vulnerable. If you're recovering during a weekend, make sure a loved one checks in or visits, even just to observe. You know who to contact if something feels off. You keep track of your medication and symptoms. Write it down. Set alarms. If you're alone, ask a friend or neighbor to call and check on you. A quick chat can make all the difference if you're feeling weak, dizzy, or confused. And remember this, trust your instincts. If something doesn't feel right, press the call button. Ask questions. Speak up. Too many complications go unnoticed because someone didn't want to bother the nurse. But you are never a bother. You are a patient. You deserve care. This isn't about fear. It's about preparation. The goal is not to scare anyone away from getting necessary surgery. Sometimes, delaying can be more dangerous than going in on a Friday. But if you do have the option to choose wisely, early in the week, early in the day, with the best chance of a full team watching over you. One of the wisest things we can do as we age is this: plan for the moments that matter most. Surgery is one of them. If no one else has told you this, let me be the first. Your health decisions matter. Your voice matters. Your timing matters. You have every right to ask, to advocate, to plan, even if it feels uncomfortable. Because this is your body, your future, your peace of mind. So next time you're faced with surgery, remember, timing is not just a detail. It could be everything. Stay informed, stay empowered, and stay well. Thank you for spending this time with me.